Thank you, Tony, for the introduction, and thank you, Louise, for your nice talk, because I think you greatly summarized the problems families face every day. I want to give you a small introduction in what we do here in Germany. I'm an adult psychiatrist, and no, I need to. Yeah, and I want to talk about who we are. We have an outpatient department for mental health and rare genetic disorders, where we mainly treat people with PWS. And I want to give you a small introduction into how our service is designed, who we are, how we work. And then I want to discuss with you what we've learned over the past years, what our experiences were, and at the end, I think I want to talk about the ideal setup of like mental health service for adults with PWS would be if I could design it in an ideal health system. So I work at a medical school, Hannover, in the Department for Psychiatry, together with Christian and Helge. And as you see, we are not really diverse in our group. We are all psychiatrists. We don't have we don't have psychologists, for instance. We're only psychiatrists, and we're only adult psychiatrists, which is a problem because in Germany, we are not allowed to treat people under the age of 18 years. But for our outpatient department, we now are allowed to also treat people starting at an age of 12, because we are the only ones in Germany who are experienced in treating people with mental health issues and prader-willi syndrome. The department exists since 2014, and we treat around 130 patients per year. So I think we've have some experience just by the numbers of patients we see per year. And we work in different settings. One setting is an outpatient setting where people with PWS come to us seeking for a consultation. We start at the age of 12. Most of them are living at home, and mostly they only have a one-time consultation. But some of them have like a regular treatment in our outpatient department. And then we have those specialized care units for people with Prader-Willi syndrome in Germany, and we are able to treat the persons who live there. And we now actually have around 5 care units where we take care of the patients, and we go there for visitation like 4 times a year. And they can call us every time they have a problem, and then we try to help them over the phone, changing medication, for instance. And what we also do sometimes is giving advice and help for other professionals, like general doctors, psychotherapists. They contact us if they know a person with PWS and they're seeking for advice, what to do. And often the parents ask their doctors to contact us. So we had this case this week where a psychiatrist from Bavaria contacted us because the parents insisted, because she has psychosis and they are not really, it's not on a good medication. And so he contacted us, and we probably can help them just by telling what our experience with PWS is. Now I want to go over the things that we've learned, and I think what we learned are also the challenges in providing a health system, or mental health system for people with PWS. It takes time, and it takes a lot of time. And the problem is that we are not full-time working for people with PWS. We are just working in a psychiatric department. I'm in charge of a gerontic ward. Christian is in charge of another ward. So we have a lot of things to do in our daily life, and PWS is something like a side project where we can spend like 10% of our time, of our work time. And so that's a problem, because it takes a lot of time to see the people with PWS. It's not like the normal patient where we can just chat and have like 10 to 20 minutes to see what's the problem and to provide help, but we normally take like 60 to 90 minutes for the first time. It takes time to talk to the people, but it also takes time to talk to the parents, not the patients, the parents, because in my experience, that's the most important point, is to talk to the parents and take your time to hear their story, because they experience that no one has experience with PWS, and they are the, how do you say it? They know best what's wrong with their children. And it takes time to see a change. That's also a big point. You can't expect to see changes over a few days. Often we talk about months of treatment, and you need to have the resources to provide that. And also time is rare for really important things, in my opinion, like IQ testing, psychometric testing, which often are not performed because we don't have the time. We wish we would have the time, but we don't. And in emergencies, such as Tony described, in an emergency situation, we often don't have the time to provide help, because we have a full calendar, and if there's an emergency, we can't just give them an appointment the next day. Often they wait for weeks or months. And also, if there's an emergency in our outpatient department, we don't have the possibility to administer them to our hospital. Yeah. So we need to manage everything in the outpatient department. Then the big point is medication. Often the parents and the people with PWS come to us with the expectation that a drug changes all the problems, and we need to have spent time to do like psychoeducation to tell them how medications work and what they can provide and what they can provide. And what's important for you to know is that you don't treat the patient, you always treat the environment. So you can't only consider the patient as a problem, you always need to check how's the family situation, how's the school situation, where do they live, what problems do they have in life. You can support the patient with a medication, but if you don't treat the environment, you will do not see a change. And in my experience, and I know the research numbers are a little bit higher, but I think that things such as psychosis are a problem in prader-willi syndrome, but only in a few cases. 90% of the consultations we see are around things like temper outbursts, so behavioral problems. And in my opinion, they don't start at the beginning of adulthood, they start earlier in life. And we often see patients who are like 25, 26, and they have problems for the last 15 years. And it's hard to change anything at that point. It takes a lot of time. And that's something I wish we could provide, but we can't at the moment, is a continuous support for families and people with PWS over the lifespan. So the ideal setup, in my opinion, would be a multi-professional team of psychiatrists, general doctors, psychologists, social workers, not only for the people with PWS, but also for their caregivers, for the parents. As Louis said, they are in great need of help in many instances, not social instances, like a lot of them lose their job, they have financial problems, they don't know what to do if they need time for themselves, they have also mental health problems, they don't go to psychotherapy because they don't have the time, they spend all the energy on providing help for the person with PWS. And you need to provide this help not only in emergency situations, but you should establish it long before an emergency occurs. And we're always happy if parents come to us and say things like, yeah, actually we don't have a problem at the moment, we just wanted to have your advice what can happen in the future, because then we can talk to them, we can give them hints what are red signs, red flags they need to watch for, what can they do. And for us, it's really helpful because we know the person's PWS in his normal mood, and we can then see what really changed in his behavior, which is really helpful for us. And the last point, the most important point for me, is time. In Germany, the health system is quite good, but we don't have time for patients who need more than normal. It's really difficult, and I think you need the right funding to provide those ideal setup. And I think our outpatient department provides a good help for people with PWS, but I think we could do a lot better if we have the time and the resources, which we actually don't have. So that was just a brief introduction in how we work and what I think is important if you want to treat people with mental health issues and PWS.